Section 1. Understanding objective signs, the body's visible language. When you feel unwell, you often describe your experience to a doctor. Headache, nausea, fatigue, these are symptoms, your personal feelings. However, there is another category that is crucial for healthcare: objective signs. These are indicators that can be seen, measured, or detected by someone else, like a doctor, a nurse, or even a family member. Unlike a feeling, an objective sign is physical evidence. They provide a factual basis for diagnosis, removing guesswork from early care. The importance of objective signs cannot be overstated. They are the body's visible language, speaking even when a person cannot. A rash, swelling, rapid breathing can speak volumes to a professional. They help gather data, track illness, and gauge treatment. Think of a doctor as a detective investigating a case. The patient's feelings are part of the story, but objective signs are the clues. A temperature reading is a hard fact. What a doctor hears through a stethoscope is direct evidence from the lungs. The specific color and texture of a rash can point to a condition. These signs are consistent and comparable to established knowledge, a universal language enabling standardized, effective care. One of the most common objective signs is a fever, not a feeling of heat, but a measured rise in core temperature. When the body fights infection or inflammation, it raises its internal thermostat. A doctor, nurse, or caregiver confirms fever with a thermometer above the normal 98.6 degrees Fahrenheit, 37 degrees Celsius, an objective sign. A 3D animation shows invading bacteria triggering immune cells, which signal the hypothalamus, turning up body heat and explaining why the reading rises. Another observable set involves the skin, swelling and redness. Swelling, or edema, is fluid accumulation enlarging the area. Redness, or erythema, comes as vessels widen to bring blood and immune cells. Doctors assess by looking and gently touching for size, firmness, and warmth. Jaundice causes the skin and the whites of the eyes to turn yellow, an objective sign of liver trouble. A 3D view traces bilirubin, processed and excreted in health, but building up when the liver malfunctions, and depositing in skin. A rash is any noticeable change in skin texture or color, clues from allergy to systemic illness. Doctors note bumps, blisters, or flat spots and where they appear, itchy or painful. Seeing beneath the surface clarifies cause and effect in seconds. To assess objective signs, doctors use tools beyond simple observation. For breathing and circulation, the stethoscope reveals wheezing or crackles, narrowed airways or fluid in lungs. A 3D view makes these sounds intuitive. Heart rate is measured precisely by pulse, or with a stethoscope. ECG visualizes electrical activity and reveals arrhythmias. A pulse oximeter measures oxygen. Simple device, objective number. Palpation evaluates swollen glands and lumps. Size, consistency, tenderness. Objective signs are measurable, observable, verifiable. From fever to lung sounds, they turn complaints into concrete data. Seeing is believing. They guide tests, narrow diagnoses, and track progress. With modern 3D animation, understanding grows, and care becomes more effective and compassionate.